Hi, welcome to another edition of RN Answers, and today I'm going to be talking about dermoid ovarian cysts and my surgery and some warning signs and issues that I came across during my surgical recovery. Do you have any dermoid ovarian cyst concerns? Well, you're not alone. In fact, millions of women around the world deal with dermoid ovarian cysts. And as I just said, I was one of them. In the past year, I had laparoscopic surgery to remove a 4.5 centimeter dermoid from my right ovary. Thankfully, the surgery went well, but I was surprised at how little information my doctor gave me about the surgery prior to actually having the procedure. What seems like a simple procedure can actually be much more than anticipated. Besides the potential physical complications, there are emotional ramifications as well. And I decided to help other women going through dermoid ovarian cyst removal feel a bit more prepared for what lies ahead. So what is a dermoid ovarian cyst? An ovarian dermoid is typically a benign cyst that is common during a woman's reproductive years. Only about 1% of dermoids are cancerous, and this is generally in women over the age of 40. But what's truly odd about this type of tumor is that it often contains hair, sebaceous glands, bone, muscle fibers, and even teeth. And as alarming as this sounds, most dermoids are quite harmless. But they can pose a problem if they grow too large, twist, or rupture. A ruptured dermoid ovarian cyst will leak out its contents into the abdominal cavity, leading to a potentially life-threatening condition known as peritonitis. There seems to be some sort of secret surrounding this particular surgery. Maybe doctors don't want to scare off their patients, but I've found that many physicians are not entirely honest about the amount of recovery time required for ovarian cyst removal. Whatever they tell you, it probably won't be entirely accurate. Given my experience, I would say at least 2 weeks recovery for laparoscopic and 6 weeks time for open surgery. Complications will prolong your recovery time, but here is what I found to be the most common after effects of dermoid removal. Expect lots of bloating. I was shocked by the amount of gas and bloating I experienced after surgery, but it does make sense. Air is pumped into the abdominal cavity so that doctors can get a better view of your internal organs. I had so much abdominal bloating that it almost looked like I was in the early stages of pregnancy. My advice is to use an over-the-counter gas remedy with simethicone as the active ingredient to help disperse the gas in your abdomen. Avoid gas-producing foods as well. Pain everywhere. Unfortunately, the incision site and all the gas used to fill the abdomen also cause sharp pain. This pain is usually in the neck, chest, and back areas. I remember that trying to lie flat on my back was nearly impossible immediately after surgery. And of course, trying to get a good night's rest became extremely difficult. And yes, it hurt to cough and laugh. There was no bending at the waist and definitely no reaching to get items off of a high shelf. My suggestion is to use a pillow to brace the abdomen when coughing or laughing, and really try to walk as much as possible to regain muscle strength and to disperse gas bubbles. Constipation preoccupation. Since you'll probably be taking a narcotic pain medication for all these gas pains, you'll most likely experience constipation. And constipation is also caused by a lack of movement and is a natural side effect from abdominal surgery. One solution is to definitely take small walks to get things moving again. Unending periods. Ovarian cyst removal throws your entire reproductive system out of whack, so you can look forward to experiencing prolonged menstrual periods at least for a little while after your surgery. Your first period after surgery may be up to 2 weeks in length, so don't be shocked, and I've definitely warned you. Oops, where's my voice? As with any surgery that requires the use of general anesthesia, expect some vocal hoarseness. After my surgery, I had no voice for about a week and horrible barking cough for about a week and a half. So invest in some cough drops and also try some hot lemon tea that really worked for me.